nuclei. You can see that 40. Look here. We have nuclei here too. And here we have nuclei as well. But you notice that there is a great difference between the first group and the last group. There's quite a big difference between the first group of cell bodies I showed you and the last group. What is the message out of that? What's the physiological message? Talk, man. Talk, show. Quick. Go ahead. Slow down transmission. All right, anything else? You perceive certain at different parts? Well, think about it. Is which part is going to get this reception?
Sir, the all light comes to the rod.
The part that is going to get it would be where my arrow is.
They coming in the direction of the arrow. Yeah.
Now, it's very important that you get that. The light that comes in is going to pass through all of these layers, come right through, and come right down to where the arrow is here. Where the arrow is here is the area of the rods and cones. That area that the pointer is at the tip of the pointer is the area of the rods and cones. I'm sorry, the magnification can take me up a notch higher because then you would see that space open up bigger. But the rods and cones are all, their heads as it were, are in the pigment layer. And the pigment layer is referred to as the retinal pigment epithelium. So there's a retinal pigment epithelium that the rods and cones are fitting into. And it is very important that they are inside there because they need nourishment. They need nutrition. And they also need renewal. They need renewal. They're doing a lot of work. It's about 147,000 of them in 1 square millimeter. So, and their blood supply is very high, and it needs to be that high because a lot of heat is generated inside there from activity. So you need to have them cool down. So their heads are in the pigment layer, and the vascular zone is all of this area here, all of this area here. Here is vascular zone. Okay? Vascular zone. And the vascular zone is part of the choroid. The blood vessels get into the choroid layer. Okay. So, out here, we'll have a so-called pigment layer, or retinal pigment epithelium. And then we're going to have these rods and cones. Okay, rods and cones. And then we will have outer limiting membrane. Outer limiting membrane. Outer limiting membrane. The outer limiting membrane is about layer 3. Yeah, because you have the retinal pigment epithelium, and then you have the layer of the rods and cones. And then where the projections are, and then you're going to have the outer limiting membrane, and then you're going to have the substantial layer of the, which is the outer nuclear layer. So this is the outer nuclear layer. Okay? So once you come to the outer nuclear layer, you are at layer 4, fourth retinal layer. Now internal to the outer nuclear layer, when we talk about, alright, let me just mention here that we have been going in a vertical direction, because we started at the pigment layer, then we went to the layer of the rods and cones, then we went to the limiting membrane, and then we went to the outer nuclear layer. But we have been traveling how? Vertically. Vertically. But we need to be able to link up. We need to get some horizontal messages going across so that we can all flow together, because if you notice, the outer nuclear layer is very dense, but the inner nuclear layer is not so dense. Neither, and look at the most internal layers. The number of nuclei down here, in this layer, is comparatively low. So what is happening is that a lot of convergence must occur. A lot of convergence, and what is it that helps the convergence is the lateral cells that pull in others' communication, lateral communication or horizontal communication. So you're going to have in the nuclear layer, in these zones, you're going to have cells that are allowing for lateral or horizontal communication. Okay? So you're going to find some horizontal cells and some amacrine cells and so on. They are going to help with the lateral communication. Alright, now, so once we pass the outer nuclear layer, then we come into this intermediate layer, and that is going to be a layer of a plexiform layer. So that is going to be the outer plexiform layer. And then internal to the outer plexiform layer is going to be another nuclear layer. And that nuclear layer is the bipolar layer. That's the bipolar layer. So those are some true bipolar cells that are in the middle right there. Internal to that, we're going to have a inner plexiform layer. Another plexiform, because once you have neurons and neurons, they have to communicate. And they're going to communicate through synapses. So the synapses is what makes the kind of plexus, the network. So there's going to be another plexiform layer. And then we're going to get to our inner nuclear layer. Inner nuclear layer, or sometimes referred to as the ganglion layer. Sorry. Our ganglion is these pinkish fellows. These are the ganglion layer, right? And then internal to that, what we'll get, all of these ganglion fellows, they have to have fibers. So this is going to be a fibrous layer. And then internal to that, we're going to have our inner limiting membrane. So that gives us our 10 zones, 10 layers for the retina. And then internal to that, we'll have our vitreous. Now, a little bit on the outside here. We have this layer out here, and this layer is the choroidal layer. But the choroidal layer has different layers inside it too. And so just external to the pigment layer, we'll have a fine layer, which is referred to as Bruch's membrane. And then just outside of Bruch's membrane, we find our little capillaries. So that is referred to as the choriocapillaris. Choriocapillaris. This is where you have your smaller blood vessels, and they are bringing in the blood into the area. And then outside of that, we have look at the size of the vessels. So as you come from the core of your capillaries, you're coming into bigger vessels. Look at this one here. Quite a big vessel. But as you go out, they even get bigger. You follow? So there are different names. We talk about Sackler's layer and Haller's layer, but they are vascular zones, that can bring a rich blood flow into the choroid and so helping cooling down and modifying the activity of all of this electron stuff that is going on in the layer of the rods and cones. So what will happen in practice is that the light will shine through here, shine through, and come up here. When it comes up there, it is going to meet the pigment layer, and it can't pass through. It cannot pass through the pigment layer. And whatever light is not dealt with by the rods and cones can be absorbed by the pigment layer. Okay? But light is going to activate the rods and cones, and the rods and cones have different proteins inside them. So the rods are going to have rhodopsin, and then the cones are going to have different chromophores. And these chromophores help them to be able to pick up different wavelengths. So basically you want those that will pick up your red, your blue, or green. Your primary colors, yellow, those will be picked up. And then what they will do? They will work on which molecule? What is inside that they're going to work on? Stephen, which molecules they're going to work on? All these light particles. In the retina, what proteins are going to be present within the rods and cones that can be acted on? The iodopsin. The iodopsins, and this is going to cause something inside here to change. What is it that makes it change? Is it neurotransmitters? You're going to change the effects of retinaldehyde. What is retinaldehyde? What vitamin is present in the rods and cones? Vitamin A. Vitamin A. Vitamin A is, what's the structure of that? Alright, okay. Alright, well, I guess Chevron can tell us what this vitamin is looking like. How many oxygen atoms it has inside it?
We have about 11 double bonds.
Alright, it only has one oxygen atom. One oxygen atom. So it's about C20H30. One oxygen atom. So you can have a retinaldehyde. Only one oxygen atom.
Double bond.
Well, double bonds, you will have double bonds. And these bonds will allow for the cis strands change. Cis strands forming differences, right? You're going to energize your GMP, and you're going to activate a lot of your rods and cones and send the signal towards the internuclear cells, and then their cell will send it down to the ganglion layer, and that will go off to the lateral geniculate body. All right, let's just make a shift from the